Hey everybody, good afternoon. My name is Dustin Strong, and this is what we call our Ask Me Anything Hour. This is where you can ask us any questions about health, holistic health, nutrition, and you can ask us right now while we're doing this, or you can email us at info@strongonhealth.com. We will put them in the queue to be answered. We usually get to about 5 different questions every time, and we're going to be getting through those. Now, we've got some really interesting questions today. And one of the reasons we do this is we want to get people to start thinking for themselves, and instead of us teaching you what to think, we want to teach you how to think, because unfortunately, too many times now we're going out there and we have doctor versus doctor giving us different absolute opinions on this. So how do we determine which doctor is actually the one who has the truth, the one that we should be listening to? So much conflicting information out there, and so many people citing this study versus that study. So what we're here to do is sift through all that nonsense and help us find a really common sense way to come to a conclusion that makes sense to you as an individual and actually feels appropriate to you as an individual, so we can actually start looking at things from a different point of view. And hopefully we are empowering you to do that. Now hopefully you guys are finding that to be true with everything that we're talking about, and please do give us some pushback if you ever find anything that we're saying here that isn't actually in harmony with what you believe and what you're finding in your life too. And again, for those of you who are just watching this for the first time or finding this really helpful and watching this a lot, please do share this with your friends. I've got some great questions. I'm going to get into them right now. We're going to talk about Cologuard testing for colon health. We are going to talk about Hashimoto's and the Hashimoto's Mediterranean diet. We're going to talk about biotin vitamins and all these videos you keep seeing from these different doctors. Danielle, thank you for sharing those with us. We're going to go into this a little detail on the next one when we have a little more time. And a question about headaches. So I'm going to start with headaches actually and work my way back to the beginning. So the question is, when a headache comes on, my first instinct is to still take a few ibuprofen. Is there a more natural way to get rid of headache quickly and efficiently when you are on the go or have to work and cannot bear to wait one out? Okay, great question. Thank you for asking. First of all, if the ibuprofen is working, then that's the information that you need to help you with this. When it comes to headaches, there are so many things that could be contributing to it, and we find that we really need to know a lot more about the individual before we can start to make any suggestions as to where the cause of this headache is coming from. But at the end of the day, a lot of it has to do with inflammation. What's causing the inflammation? And if the ibuprofen is working, then of course that's working because it's reducing inflammation. It's an anti-inflammatory. So what we want to do is figure out, number one, what had we done previous in the last 24 hours that could be contributing to that inflammation, so that we don't keep doing that. But we can also look at things that are going to help us resolve the inflammation really quickly, and I think that's what you're looking for. My number one thing that I would reach for personally if I was trying to reduce inflammation in my body would be a good healthy fat. Fat helps resolve inflammation, and I would do that in terms of like a healthy tuna oil, a good fat-soluble chlorophyll would be very good, black currant seed oil. Those types of healthy fats are going to help us resolve the inflammation. In fact, black currant seed oil is really helpful for the reduction of inflammation. Now, the other thing that I would probably be reaching for immediately would be something with turmeric in it. MediHerb's Turmeric Forte I find to be the most effective for me and for most of the people that I have talked to. It helps really resolve that inflammation and reduce it. Now, there are many other things that you could do to help resolve inflammation, but if I'm going to give you 2 quick things, that would be what I'd be reaching for: turmeric forte and probably some kind of black currant seed oil or chlorophyll or tuna oil or something to help resolve that inflammation. Now, a lot of times there is digestive stress involved with that, and that's why I want to know more about you as an individual. I want to figure out where are you feeling the headache, what time of day is the headache coming on, a lot of more information about that headache to help give you clues, to help you understand why you're getting the headache in a way to make sure that you can keep yourself from ever having to reach for that ibuprofen or whatever anti-inflammatory that you're going to be taking. Okay, hope that was helpful for you. All right, so the next question is, I've been seeing videos for years that say your metabolic type determines what type of diet and exercise is right for you. Have you seen these videos? Many of mid-age women shouldn't or don't need heavy cardio working out that a 20-year-old needs. Any validity to this? I can't seem to change my body as much any longer now that I'm 48, same way I did 5 or 10 years ago. Okay, awesome question. So we often talk about the importance of addressing individual needs. There's no one size fits all for this, but when we start to see people taking advantage of this and trying to create a metabolic type, and I know what the ones that you've sent me actually links before, Danielle, I think, about this individual, this doctor to the Kardashians, and he sends you this questionnaire, and I actually went through it to see what they would give you, and it asked some ridiculous questions. At the end of it, he told me exactly what my type was and exactly what I needed to do, and it had nothing to do with me as a person. So be very careful without somebody really knowing about your whole history, whether or not they're going to be giving you guidance on where you're going, because there's so much that has happened over 40 to 50 years that is contributing to where you are right now, and you really need to take all of that into stock. Here's what we do know. We do know that human bodies require certain nutrients, and I am more and more convinced every day that attention on the appropriate amount of the micronutrients, so we're talking about things like potassium and magnesium and iodine and zinc and copper, all of these things that we haven't really been paying enough attention to and understanding how our body uses those, is really going to come to inform how the body's functioning. Whether it's this metabolic type or that metabolic type, it doesn't change the fact that we have to have these nutrients in there. And so when we're ignoring whether or not this person has been getting enough of these nutrients for 40 or 50 years and saying, well, it's because you have a metabolic type, I take issue with that, because it's really not being fully understanding of all of the most important factors that are essential for every human. So instead of just going with this metabolic type thing, I would start to understand, well, what is happening over these years? And when you start to see people having difficulty with any health conditions as they're aging, the first thing we should be looking at is what has been going on that they may have been creating a deficit slowly over years, and now they've hit that turning point. They've hit that critical mass where all of a sudden their body is really desperately starving for this nutrient, and they're just not getting it. So all kinds of metabolic function is going to be compromised. It doesn't matter what kind of metabolic type you are if you're not getting enough potassium in your body. You're a human. You need potassium. It doesn't matter what kind of metabolic type you are if you don't have enough iodine in your diet. Doesn't matter. You're a human. You need iodine. So let's pay attention to those things and understand that perhaps that our digestion has been compromised for a long time, so we're not getting those nutrients, and we've just been starving ourselves. I will go more detail into this. I want to be fair and make sure that I really read into everything that Dr. Guglia, I think his name was, had to say, and that other practitioner that you mentioned. I really want to give them the benefit of the doubt and go through some pros and cons, so I'm going to spend a little more time when I have that time, which will be, I'll find that time, and I'll give you a little point by point on each of those guys. But first and foremost, don't allow somebody to tell you that there's limits on how you can perform when they don't know what your micronutrient makeup has been for your whole life. Okay? Take that into stock and understand that you have a lot more control and a lot more power over it once you fuel your body with what it absolutely needs to optimally function. Okay, so going on. Hi Dustin, I was taking Biotin vitamins. Could they cause metal taste? I just started happening a couple of days ago. Thank you for the question. I'm not a huge fan of Biotin supplementation. So many people go out and they're told by someone, well, for hair, skin, and nails, you need biotin. You gotta get biotin. So they go and they get this massive amount of biotin. And I don't like when people try to take one tiny little isolated component and push it in there by itself. The best sources of biotin are gonna come from whole foods. That's why I eat raw nuts and seeds every day. You're getting them balanced with a bunch of other things. And you're definitely gonna get your biotin in there if you're doing it that way. Now, if you're getting a metallic taste, usually that's a sign to say maybe I should look at my liver function. Oftentimes they've said historically when you're tasting that there's something going on with your liver. So that could mean that there's something contaminated in the vitamin that you purchased. There is very, very little regulation and supplementation, especially vitamin supplementation. And so when they start assaying these things and they see what's going on in them, there's all kinds of garbage in them. There's all kinds of different elements that aren't even represented or equal to what's on the label. So be very careful with where you're getting supplements from, because it can be a real problem, and always favor whole foods so you're getting it in a balanced form. So if that's the case, and again, now be careful that you are not having other things that are creating that metallic taste and you're just associating it with the addition of the biotin. But I would definitely start thinking about supporting my liver a little bit more. And there's a lot that your liver needs. Your liver needs a lot of cruciferous vegetables. It needs things like beets and beet greens. It needs all kinds of nutrients to support all of these different detoxification pathways. So I would definitely look more into supporting my liver and possibly remove that biotin for a few days, see if the metallic taste goes away, and then, I don't know, look at the value and the quality of that biotin supplement. Okay, Julie has a question. Hi, Julie. Should legumes and soy be avoided for Hashimoto's, as per Hashimoto's protocol by Isabel Wentz? I was recently put on a Mediterranean diet by my doctor, and they want you to eat beans 3 times a day. Okay, love this. A great question, Julie. I think that there's a lot of value in beans that we have to be respectful of, and this goes back to digestion. One of the things that people don't talk enough about is the reason that people are having a problem with beans is they're not fully digesting the proteins in them. So you've got people like Dr. Gundry saying that beans and tomatoes are the devil because they have lectins in them, and the lectins get into the blood and they stick to the blood, and we have this problem. And that can be concerning, but if you're digesting lectins, proteins, you shouldn't have a problem with them, and you need stomach acid to do that. So anytime you're having any problems with it, my first question would be, how's your digestion? Are you able to digest those proteins? Even people who go so far as to look at the blood type diets, they're looking at how different people are responding to different proteins in it, and the people shouldn't be having a problem with those proteins if they're digesting them in their stomach in the first place. So there's so many things that we could be removing from this cloudy confusion if we just made sure that we're fully digesting the proteins in the first place. So when it comes to beans, let me just remind you of 3 things about that. Number 1, the blue zones, the places where people live the longest, have the lowest rates of obesity, lowest rates of heart disease, lowest rates of cancer. These are the areas around the world where people use beans as a cornerstone for their diet. And that's what we're trying to do here at Mansfield, is create a similar experience so that people have healthy options made easy to them. So just like Fort Worth became a blue zone, we're doing our best to do the same here. So if they're doing it in the blue zones, I'm going to look at it with a little more respect. Number 2, when we're looking at an American diet, there are major things that are missing from that diet, and usually those are the micronutrients we were just discussing: magnesium, potassium, and fiber, okay? So if you have had a fiber deficient, magnesium deficient, potassium deficient diet, one of the best ways to help you figure out if that's what you're experiencing is due to that is just to add beans into your life, because they almost, 1 cup is going to supply you with almost 100% of all 3 of those. So it's a very good multivitamin to be able to rule out some nonsense that could just be due to not getting enough potassium. And number 3, they are available almost everywhere, especially if you're in Texas. Every Mexican restaurant is going to have black beans on the side, pinto beans on the side, and they are cheap. They are the most affordable multivitamin on the planet. So before you completely rule out beans, make sure that you can digest those beans and think about getting them in an appropriate amount, okay, into your life. Okay, so Cologuard, testing and colon health. Thank you for the questions on this, and this is something that people are now doing. It's a home test, and everybody from Harry Connick Jr. to the Green Bay Packers have been talking about how great this is, because when you turn 50, you have to get your colon checked to make sure that you don't have colon cancer. So colon cancer is a big deal. We have around 50,000 deaths a year from it. It is the 2nd leading cause of death due to cancer, and it is very, very concerning. So that's good to have information to let you know whether or not you are heading towards it, because it is a lot of doctors will agree it is one of the most preventable ones that we can be looking at. Now, again, I'm going to bring beans back into this because fiber can be very important to that, and all of those micronutrients can be important to helping with the prevention of that, making sure you're doing it right. So I would first of all say, educate yourself first on all the things that you could be doing to prevent colon cancer and integrate those into your life, and then take the test, because you're already doing the right things. You're doing what you can do. Now, if you do take that test, just so you know, it's only about 93% of the cancers are going to be caught by that, according to most of the research that I've looked at. It is non-invasive, so that is what people are looking at for it. But there's some really interesting articles written out there by a lot of medical doctors who are concerned about the fact that, I think the statistics said 1 in 6 people are going to get a positive read on that. And when they go further to it and they actually get the colonoscopy, it's only 45% of those people actually needed to do that. So it is causing a little panic, and it is causing people to be a little more worried than they should be. Here's what I like about it. I like that it's making people think about their colon health, and they're going to take the steps to help do what they can to keep their colon healthy. If you're listening still at the end of this video, because it's getting long, just do those things. Do everything you can to prevent it. There's so much information about there. And if you do take that test, remember that just because it was a positive, where did that book go? Does not mean necessarily that it is a death sentence. It is one of those things to let you know that there's a lot more you can do about it. Pay attention to that. And if you do, there are other tests that you can do other than the colonoscopy. Now, that is the gold standard according to a lot of them. There's a lot of debate on that, of course. But use that as information to empower you, as opposed to create a lot of fear in your life. We doing okay? Do we have any questions on there so far? Because I'm going to go with one last thing. Okay, This month, we're about to send out our Strong and Health box, the Strong Brain box. So everything we're doing is try to help people understand the importance of prevention and what you can do now to keep your brain as healthy as possible and keep you as far away from dementia and the concerns that we have with cognitive decline. Awesome book. Thank you so much, Dr. Kerber, for giving me this book. I really appreciate, loaning me this book. Actually, I think it's your mom who gave it to you, who gave it to me, so thank you, Mom, for that. It is a fantastic book because Dr. Stephen Masley talks about how you can, at any age, reverse and prevent cognitive decline. So if you do not believe that, please read this book, or at least read a review of this book, or get it into your life. What I really like is they have some very interesting aspects about 7 myths about memory loss, and he dispels these very quickly, and it's important for people to understand truth versus what fear and panic are creating as far as a myth, because it is a very big concern. A lot of people are headed in that way, but there's a lot you can do about it, and I really can't encourage you enough to start doing those things. So some of the myths are, it only happens to old people. That is not true. Alzheimer's disease can strike people in their 30s, 40s, and 50s because of all of the contributing factors, all of those unknowns, all those things that we talk about that are slowly creeping up on us. Once you start to recognize and remove those things, you have a much better chance. Memory loss is a normal part of aging. This is my favorite that he says right here. Just because you're getting older, that has nothing to do with it. It's all of those other stressors. It's all the things that are contributing to it. Being old does not equal losing your memory. You can keep your memory and be as old as you want to be, all right? All right, memory loss is caused by vaccines and flu shots. He dispels that. Memory loss is caused by aluminum cans and pots and pans. Now, what I want to say about this is he does recognize here that he still discourages people from using aluminum pots and pans, as aluminum has no known health benefits. That's so important to pay attention to. If we don't know that it has health benefits, then let's maybe be careful not to add too much of it to our life. I love his approach in this book. It's a fantastic book. Myth number 5, you can't improve your mental performance or prevent memory loss, so don't bother trying. Brain cells can't be repaired. Fortunately, hundreds of scientific studies show that you can improve cognitive performance, so do not buy into that garbage. Number 6, Alzheimer's won't kill you. That is not true. It actually can be deadly. And number 7, there are treatments for Alzheimer's disease. Now, at this time, he does put very clearly there are no medical treatments to cure or to stop the progression of Alzheimer's. So the most powerful thing you can do is observe the lifestyle and dietary things that you can do to change your brain. So if you know anybody who's concerned about this, and we all do, take the time to look at this book. It's a fantastic book. It's The Better Brain Solution by Dr. Stephen Masley, MD. Really enjoying it. Okay, lots of info. Thank you guys for watching. Really appreciate this. I hope you're finding some inspiration in this. And I'm getting the wrap it up signal back there. So I'm wrapping it up. Next week, Tuesday, we're going to go for the next 5 questions. I'm going to go a little deeper into these as we move along and make sure that we're addressing all of them. One last note. In this book, very important connection between blood sugar. Okay, high blood sugar and people having diabetes and blood sugar challenges, his number 1 concern with that is the correlation between those two. So next month's box, after the brain box, is our blood sugar balancing box. There's always something you can do, and it's multi things that you can do to increase your health, and we're going to try our best to be sharing all the things that we learned with you so you can become healthy, happy, smarter, and all the things that you want to be. Okay, thanks guys. Have a great weekend.